Hi, my name is Neve Mundell, and my research program explores how embedding exercise early into patient recovery can improve outcomes for patients, healthcare providers, and healthcare systems. So this particular project is titled An Emergency Department Exercise Trial and Referral Approach, an extra care pathway for patients living with chronic conditions. And the project itself is a collaborative effort between researchers at Eastern Health, Monash University and Deakin University. The current overburdened healthcare system means that a lot of patients with chronic conditions are not seeking the appropriate care in the community or not able to access the appropriate care in the community, and they wind up in the emergency department for otherwise preventable health problems. This contributes to the overcrowding, exacerbations in the emergency department setting, and often patients with chronic conditions are discharged without structured follow-up, meaning that often their conditions are poorly managed at home and then they wind up back in the emergency department. So this study aims to address some of these gaps by linking emergency department discharge to some community-based services which are going to support self-management, specifically for this project, exercise physiology and also self-management using exercise. So we want to empower patients to take better control of their own health and reduce those repeat visits to the emergency department. So by participating in this study, there are some staff contributions which will be creating a system that prioritises a more timely intervention, better patient outcomes, and hopefully a reduction in staff workload in the emergency department. So it does align with the broader goals of integrated care and collaborative practice and ensuring patients get the right care at the right time and in the right place. But before we can determine whether or not this approach is effective, we first need to determine whether or not it's feasible from both a patient perspective and a health system perspective. So our feasibility measures in the study will assess participants' willingness to accept and engage in the intervention. We'll also be following up at 1 month and 3 months, 2 months post-discharge, which are our follow-up dates, and we'll be collecting uptake rates then. So the intervention was developed through a co-design process involving staff, patients and allied health, and other components which are separate to this particular intervention, including educational and resource development component for staff and patients. Some examples of chronic or complex conditions where there's substantial evidence to support exercise aiding the management of health for these populations include, but are not limited to, some of the following. In cardiovascular and metabolic conditions, it can help to manage blood pressure, cholesterol, blood sugar. It can help with liver health. It also lifts mood and reduces stress in those living with mental illness, lowers dementia risk, reduces cancer risk, and improves recovery. In fact, exercise is really, really important all along the cancer trajectory. For musculoskeletal and neurological conditions, it's got a very important role to play in pain management, supports bone health, improves mobility, and it also offers benefits for neurological conditions by improving function and maintaining function, preventing functional decline, and it helps those living with COPD by improving respiratory function, among many other conditions such as asthma and other respiratory conditions. In short, exercise is a really powerful tool that supports physical and mental well-being across a broad spectrum of chronic conditions.
So the evidence is pretty clear. We've got lots and lots of evidence already for the effectiveness of exercise. In particular, exercise guided by professionals such as exercise physiologists and other allied healthcare professionals, such as physiotherapists and occupational therapists, can be a valuable, adaptable tool for managing complex and chronic conditions across different populations, including those who are facing healthcare delivery challenges such as rural, regional and remote patients. There's evidence that timely, accessible, community-based management, as I mentioned, has all of those positive effects for the health outcomes of people who are living with chronic diseases or conditions. And it's also the case that patients are more likely to exercise when they're advised to do so by healthcare professionals, and this improves adherence. So despite all of this evidence, practice hasn't kept pace with patient need, and there's a gap between the knowledge that we have in translating that into action. So the extra study aims to bridge this gap by integrating early sustained exercise interventions for people living with chronic and complex conditions.
This slide summarises staff contributions to the study and the study structure. Staff contributions essentially just involve two steps. Firstly, providing a flyer with study details or providing the QR code to the flyer with study details to eligible participants. Then if they're allocated to the intervention arm, sending a referral when the participant's discharged. So I'm going to drill down a little bit into the whole process and structure. The study involves low acuity, clinically stable patients with chronic conditions who are soon to be discharged from the main emergency department. They can be in the short stay or fast track, but not from the general waiting room. We're not approaching patients in the general emergency department waiting room. They need to be 18 years or over, speak and understand English, and have a chronic health condition or disability which limits their everyday activity and would benefit from exercise advice. They need to have access to a smartphone or computer at home. And finally, the treating clinician must be aware of the study and agree the patient is suitable for participation. So if any staff clinicians feel that they would prefer a different pathway, then they do not need to recruit that patient. So to quickly identify whether a participant could benefit from, would be suitable for participation and potentially benefit, consider whether their disability limits their daily activity or they're struggling with a physical activity due to weakness or pain, and would benefit from individualised tailored exercise, which is the type of advice they're going to get. They'll be asked, the participants, once they opt into the study, they will provide consent, once they've consented, they'll be opting into the study. They'll complete a survey and then they'll be automatically randomised to receive either a free telehealth consultation with an exercise physiologist or written, digitally provided advice about exercise to help them manage their condition. Once a client opts in and agrees to participate, the randomisation process occurs automatically via REDCap, and the patient will receive an email notifying them of their allocation. The staff will be informed by a member of the research team only if the participant is randomised to the intervention or the referral arm of the study. And then only if the participants randomised to the referral arm, the staff member writes referral to the study exercise physiologist, and you can see the email address there, which is neve.mundell@deakin.edu.au. You're also welcome to use that email address at any time to contact me. I'm Neve with any questions. And a research team member will be a research team member on site will also be available to answer any questions or assist in identifying potentially suitable patients on recruitment days. For any questions or support about the study at any time, staff or participants can contact myself, Neve Mundell. The email address is there on the screen, niamh.mundell@deakin.edu.au. Or you can contact the study coordinator at the Eastern Health Box Hill site. Patrick Owen, his details are there as well. We've also got additional resources including flyers, fact sheets and a quick guide that you can pop on your lanyard to assist staff in delivering the protocol effectively. So thank you very much for your time and your commitment to patient-centred innovation to support better care delivery and collaboration among emergency staff, patients and community health service providers.